Namaste and greetings. I, Shweta Shankar, researcher at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi, extend my warmest welcome to you all to IMPRI #Web Policy Talk. We are gathered today for a book discussion on an intersectional gender discourse on empowerment during pre and post COVID-19 pandemic, authored by Professor Vibhuti Patel and published by IMPRI Books. Congratulations, ma'am. This discussion is organized by the #IMPRI Gender Impact Studies Center, GISC, as a part of IMPRI #Web Policy Talk book discussion series. I welcome all of you to this enlightening deliberation and thank you for tuning into this discussion. Now, let me introduce the esteemed gathering. Our chair for the session is Professor Sanghmitra Sheel Acharya ji, Chairperson and Professor, Center of Social Medicine and Community Health, Jawaharlal Nehru University, JNU, New Delhi. We welcome you, ma'am. We have author of the book and speaker, Professor Vibhuti Patel ji, Visiting Distinguished Professor, IMPRI. Welcome, ma'am. The distinguished panelists for session are Professor Vina Vaswani ji, Director, Center for Ethics, Professor, Department of Forensic Medicine and Toxicology, Yenepoya, deemed to be University, Mangalore. Dr. Swati Savantrane ji, Founder, Seva Shakti Healthcare Consulting, Vice President, Clinical Nursing Research Society. Professor Arvinder A. Ansari ji, Director, Center for Study of Social Exclusion and Inclusive Policy, CSSEIP, Professor, Department of Sociology, Jamia Millia Islamia, New Delhi. Professor N. Manimekalai ji, Department of Women's Studies, Bharatidasan University, Tiruchirappalli, Tamil Nadu. And Dr. Samhita Barua ji, Assistant Professor, Department of Social Work, Tezpur University, Assam. Welcome to all. We look forward to learning from our esteemed gathering. Now, without any further ado, let us start the program. It is my honor and privilege to invite Ms. Professor Sanghmitra Sheel Acharya ji to start the program with the chair's remarks. Over to you, ma'am. Ma'am, sorry to interrupt, you're on mute.
I'm so sorry. Sorry. Thank you so much. Thank you so much for giving me this opportunity to be here with the very esteemed gathering, which is comprising of the very author whose book we are here to discuss. And as the panelists, we have yet another set of very, very renowned researchers, scholars in the field of, I'm sure if you can say, gender at a large level. So thank you very much, IMPRI. Thank you very much, Dr. Arjun. And thank you very much, Dr. Patel, for having written this book, collated your articles in such a magnificent way that we are all here to hear you. I'm sure, when we think about women's empowerment, we cannot do without thinking about it or writing about it without coming across Professor Vibhuti Patel's work. And alongside, I'm sure, a good number of works that have been brought into the discourse by the very esteemed panelists. So just to put set the ball rolling, perhaps, we know that when we talk about women's empowerment, it certainly is a very, very multifaceted concept, which involves promoting rights, equality, opportunities for women in perhaps all spheres of life. And therefore, I'm sure we'll all agree that Professor Vibhuti Patel, we all know her as a very fine researcher who engages with the question of women from all perspectives. And in this case, in case of this very particular book, I think she's really been very meticulous in scrutinizing how COVID particularly has made an impact on where should gender be considered as in terms of the larger discourse that we often tend to engage with. She has, in fact, to my mind, this book gives a direction to the research on women in today's context. And therefore, when we look at this book, I see it as a very, very neat weaving of the question that we weave around women, the questions which intersect with this health emergency, which we've just seen for ourselves, and of course, how we bring in the sustainable development goals. And I think that's what the USP of the book is in terms of weaving all of this. So when we talk about COVID as a pandemic, I am sure with having almost 3 years into the pandemic, having experienced how the way it has kind of taken us all on in various ways, we would probably agree that it has had both positive and negative impacts on women's empowerment. With some, of course, of the pre-existing challenges, which to my mind exacerbated. While we see newer opportunities coming in, we do have certain challenges which continue to kind of prolong. And therefore, with all of this, there is been an element which kind of takes us towards some kind of hope, where there is this light of progressing towards something which makes a meaningful living is there. So if we kind of get down to exploring how scenarios have been before the COVID, and how we're left with COVID having occurred, I think if you're looking at the three the components which are very important in pre-COVID context, I think there are three things which I would want to probably flag for us, and I'm sure we look forward to listening to the author and the panelists. The foremost, I think it's education, and to my mind, when we look at the book, it's making certain connects with whether when the author is talking about the goals or sustainable development goals, or when she's talking about the work realms of women. So I think efforts, while when we contextualize education, efforts have been made very contextually within the country, globally, to improve access for education for girls and women. And I'm sure data does corroborate it. Progress has been there in terms of reducing the gender gap also, but the challenges remain, particularly when we look at the marginalized communities, and of course in the developing regions, within the developing countries, very specifically marginalized regions. So that's something which I look forward to listening to. The second realm, I think, which becomes very important for the pre-COVID scenario, is the very economic empowerment that we kind of contextualize women, or we want to talk about women. When we're looking at women, there has been an increased entry into the workforce, where there have been evidences of some kind of economic independence, which has been kind of brought on board. However, the gender wage gap, and if I may say, occupational segregation continues to persist. And that has in fact limited women's earning potentials also. What are the career advancement opportunities? Where are the pros and cons being drawn between men versus women, if I may say, where in context of what we would consider as economic empowerment? And the third important point, which I think pre-COVID scenarios have given us, is the political participation, wherein I think when we consider women's participation, women's representation, political leadership roles, and also perhaps the decision-making processes, we do see an upward trends, although they remain fairly far away from achieving what we would love to look at in terms of the gender parity. Initiatives such as 30% reservation, affirmative actions, etc., have created those enabling environment, but we continue to be far. Still, we need a lot to be done. Therefore, I think if we contrast that with the post-COVID scenarios, what has been happening? First of all, I think there is a fairly disproportionate impact that we see of COVID. The pandemic has, in fact, impacted on women in a very different ways. It has, in fact, exacerbated the gender inequalities. Women face fairly increased burden when it comes to unpaid care in terms of work, loss of livelihoods, even higher rates of domestic violence, which women have been experiencing. There, of course, has been digital divide, and I think that's the second most important realm which we need to take cognizance of in terms of the post-COVID scenarios. How the community resilience, for example, has been in terms of accommodating the question of women. Despite the challenges, women continue to demonstrate fairly remarkable, if I may say, resilience during the pandemic. They've played very crucial roles as healthcare providers, as caregivers, as community leaders, and this perhaps has led to their recognition in terms of their contribution. They've also taken on roles wherein they've been very vocal in terms of creating that awareness in community scenarios, in realms where contexts of how different differences were being evolved. So the pandemic, as it galvanized the global efforts to address some kind of the existing gender inequalities, it also kind of paved way towards which we could see in terms of some kind of empowerment realms coming in between. The other important factor which I think has impacted on women is the realms of remote work opportunities. However much we might want to disclaim online realms of communications, and we are doing it right here, it has, to my mind, increased the acceptance and adoption of remote work because it seemingly has provided some kind of work-life balance, which women need so very much in terms of accommodating their work lives and their domestic lives. So I think in this backdrop, particularly when I look at this book, where we see different articles being put together, articles which have dealt with areas fairly wide range, but if you try to knit, I think three important realms come in: the SDGs, the work realms of the women, and in all of this, in these two particularly, how are we knitting in the question of gender? So I probably would look forward to listening to Professor Vibhuti Patel raising some of these questions, or rather some of these points which she may, I'm sure, want to focus on. So over to you, Professor Patel, or maybe we would, as you suggested, we would want Professor Vina Vaswani to come in before you speak, or if time permits, because it's already 6:14. Professor Vaswani, do you think it's a good idea to make Professor Patel speak first, or?
Yeah. I think Professor Vibhuti Madam can go and I can go after her.
I just thought as much.
That would be a great idea, yeah. But
because it's a limit, 10 minutes limit is there. So yeah. Time limit is there. So I'll try to finish it. So first of all, I would like to thank IMPRI team, Dr. Arjun Kumar, Satyam, Vitita, and Sweta for their hard work and galvanizing me into action, because I was not so keen for this book discussion. Because there are 3-4 other courses of IMPRI are also very demanding. I thank Professor Sanghmitra, Acharya, and all my academic colleagues, Professor Vina Vaswani, Dr. Swati Rani, Professor Arvind Ansari, Professor Anmani Meklai, Dr. Samhita Badua, and esteemed participants for attending this, participating in this discussion. And I have summarized my presentation. It is basically, I would like to say, in terms of it is, in a way, you can say participatory action research, because I was doing back-end job for the young people's team that was very much active managing relief camps, and I was getting daily extremely engaging conversations I had with them, because my house was also a collection center, and whenever the gated communities did not allow the volunteers to enter, so anytime they wanted to use washroom, or they were hungry, or they were tired, they would drop into my place, and they were full of stories. No? So that also made me like articulate these ideas. And when Dr. Arjun Kumar suggested that I should also try to provide the comparative scenario of what happened in the pre-COVID period and the post-COVID period. So that's how the whole exercise happened. And it is mainly because of the nudging by the IMPRI team that I put all these things together in the midst of a lot of other like active engagement during the relief work. So analytical framework of this book is basically it's an exploratory work, and it is also exploration of intersectionality of gender and empowerment in a pre and pro-COVID period. It also provides the cross-sectional gender discourse, because as Dr. Sanghmitra also said that work-life balance when it came to the middle-class salaried women, and what happened to the women in the informal sector, women in the forest areas, because during the pandemic, we used to have a lot of discussions with trade unions and Kisan Sabhas and for tribal people's organization, Dalit organization, transgender persons organization, the kind of challenges that they were facing. So this book tries to shed light on unique challenges faced by individuals, and particularly women in informal sector, lonely, elderly, sexual minorities, sex workers in this volatile time. And it also based on the empirical research and real life narratives, which personally were told to me, not as a matter of research, but as a matter of human interaction during those difficult times. It's guided by the theoretical framework of intersectionality, and this perspective is most inclusive and multifaceted nature of oppression, and also therefore opens up new pathways and provides the nuanced understanding of how various forms of discrimination, of marginalization, they intersect and influence one another. And it also, at every chapter also is weaved into what comes in terms of recommendations and what can the state and non-state actors do about it. So the first chapter is about the SDG. It was written in 2018 and for a conference in TISS. And it is, as you, I think I need not tell much to this esteemed audience with that how CEDAW and also SDGs, they have guided the whole discourse on the sustainable development goal. And well, how does it impact different sections of society, and especially the gender concerns within SDG, because SDG's approach is that of integration of gender in each and every of 17 goals, and also dedicated SDG 5 for gender concerns. The second chapter is about the question of gender justice. How do we, the whole question of education, how can we make the education far more gender just, right from the early childhood education to the integrating gender concerns and gender equality in school education. And because I am also associated with the Indian Council of Basic Education, Gandhi Shikshan Bhavan, which is based on the foundation of Bunyadi Talim by Gandhiji. So this was a concern that happened, that should we go back to that kind of approach, which is grounded and which is decentralized and which is answers the needs of the community and which also promotes equality. The third chapter is about the recent work which ILO in 2019 promoted in its centenary year, the violence-free workplace, and also the question of regularization of the informal sector, where the law of jungle prevails, and what we need social security and social protection that is required for informal sector workers, and the massive reverse migration of more than 3 crore human beings, men and women and elderly and children during the pandemic also brought this discourse much center stage. No, first time like we started acknowledging that migrant population plays a very important role. They are the city makers and they have a very important role to contribute to the economic development. Chapter 4 goes into the details of the impact of pandemic on the informal sector workers. And as Dr. Sanghmitra said, 3 important concerns. I would like to add one more, that is hunger, extreme hunger. Even the persons in Mumbai, like, oh, these skilled workers earning 800 a day, they say that we have never experienced. Bombay, you may not have a home, you may not have a roof over your head, but this is the place where you would get any range of food, right from 5 rupee pav vada to everything you get. No, first time in our life that I heard continuously, even in the relief camps where the community kitchens were going on, such a highly skilled people were standing in the line for food and all. So they said this extreme hunger that lockdown also created. On the one hand, we had 11% reported growth of agriculture, and the things were not, supply chain was completely broken. So that is also, and that in the different waves of lockdown, how partial and total lockdown impacted the informal sector workers. The chapter 5 is focusing especially on the condition of the women workers, the gender differential that you faced in terms of wages, occupational safety, health, and work condition. And on the top of it, we also got labor codes. So 4 labor codes on industrial relations, labor standard, wages, and also the question of social protection, where the whole language was in terms of he, him, and his. There was no mention of women's gender concerns and women workers. In fact, even sexual harassment at workplace was not included in the code on occupational health and safety at the workplace. Only maternity benefits was there mentioned. So otherwise, you could see that there was a complete gender blindness of this thing. And also the rural workers, the 3 farm laws, and how the women played a very important role, like Makam, Mahila Kisan Adhikar Manch. They also organized and also voiced the concerns of women in the farm sector. The next chapter is about the collective action that women have taken at Asia Pacific level. It was during the pandemic in the July 2020 that UNHRC also came up with a extremely important report, being a member of that expert committee on women's work in global changing scenario. In that also the question of massive unemployment among women caused during the health emergency, and nearly 40% of women are even not back in the workforce. So that also we have seen that the whole gender stereotypes that women are last to be hired at the time of economic expansion and first to be fired at the time of economic crisis, that is still experienced. We have seen, like, even women were reporting that even whenever they ask for employment, the both state and non-state actors, they were just telling them, when so many men are standing in a queue for work, why are you competing with them? Go home and look after your family. No. So then the next chapter is that about the women, the urban scenario, that how in the urban areas, and I think most of them have been very seriously documented by the rapid assessment studies and by the report by SWAN, and working with the migrants by ISI Bangalore, and also by the various trade unions and workers' organizations, CBOs have also documented it, that what we need is that social policy on a key role of care economy, because Dr. Sanghmitra told us about the unpaid care work, which increased. And it was around the same time, like in July 20, that Government of India, Ministry of Statistics also came up with a report on time utilization, which shows that on an average, Indian women are spending 10 times more time on unpaid care work than men. So that itself shows that recognition of unpaid care work, rewarding the care workers adequately and decent wages should be given, and also a computation of the contribution of care economy in the mainstream. That is very important. Now, coming to a very crucial aspect of how community intervention, the government may not acknowledge, but we all have known that it is the civil society and the people's organization. They were constantly supporting whatever meager resources they could use. Their personal resources as well as whatever they could collect was used for running the community kitchens. When the migrant when the reverse migration took place, there were citizens. We were inundated by the calls from shoe companies and from bottled water companies and all this. How many trucks should we send? People are walking, thousands of them are walking, they should be supported. Food packets, this thing, even at the railway stations, at the bus stations, that you saw. And when the jumbo camps were created, with the help of corporate and also by the state also gave the PDS and water and gas for running the kitchen. We saw that it was the community organizations. They played a very important role in seeing to it that there is no chaos and anarchy, and there is a elderly people, people with disability, people who are socially excluded like transgender. There were so many big religious organizations which say that our relief kit should not go to transgender community and sex workers, and there was a tremendous opposition by the CBOs and NGOs, and they said if that is the case, we don't want to do anything, we don't want to have anything to do, we don't want your relief. No, so that is the this stand. And also organization like Janaswasthya Abhiyan filed so many public interest litigations for access to foods and water and cooking gas, and also the care, the healthcare facilities for the people who were on the road, who were shelterless. And coming to the question of this thing of total lockdown and the series of lockdowns that we had, how did it impact the living and condition of the people, loss of purchasing power, and the mainstream economists also recommending that what we need is the income support. Income support, even the neoliberal economists, at least in that period, they were accepting. In fact, even the IMF young economist from India, Dr. Gopinath, she also said, yeah, we need to have fiscal expansion. So I think there was a different, new kind of thinking, that came, and also the ex-Reserve Reserve Bank of governor, he also said that it is not a burden on the economy. It hardly comes to 1.5% of GDP. Then coming to the question of what kind of gender responsive budgeting is required, looking at the condition, because gender responsive budgeting in India started in 2005, and we had a long experience of nearly 15 years of how to reduce gender gaps in the 5 vital areas of health and education and decision-making and prevention of gender-based violence and employment and skilling. So I think that during the pandemic, a lot of feminist policy collective and many other gender economists, they also say that we need to make a very, very strong, and plus there was a demand also that 6% of GDP should go. But what happened during the pandemic, hardly less than 2% of GDP was for the gender concern. So now also we need to lobby, we need to amplify the voices of gender economists. Then the question of what is our vision of the new world, and when the organizations like People's Reporter and all, they started, what kind of world do we need in a post-pandemic period? Can we have a dream? Because you know that all dreams don't get fulfilled, but it is important to dream. And that's why we also, we added this chapter on what kind of prospects, possibilities, and problems that we can have by coming up with a very humane macroeconomic policy, putting people before profit, which some of the small countries had shown us, nearly 18 countries had shown that it is possible with your national resources. It's a question of political will. And then the civil society organizations, and during by that time, during pandemic only, India got opportunity to be the host organization for G20, and the presidency of G20 came to India. So in G20 also, the discourses on Generation Equality Forum had impacted G20 discourses, and what kind of role that all G20 countries can play in reorganization of world macroeconomy, and also the respective nation states, what kind of policies they can put in place. And these are some of the references which I have used in the book. They have really guided the whole vision and analytical framework of the book. Thank you for the opportunity.
Thank you so much, Professor Patel, for taking us through the book in a very crisp way, in a very, the time which was stipulated for you. Thank you very much. Considering that Professor Vaswani has to leave soon, I'd request her to come in, and then maybe we'll get on to listening to her and perhaps the observation that others could be making. Professor Vaswani, over to you.
Thank you. Thank you, Professor Sanghmitra. I'd like to place in record my thanks to IMPRI, which always impresses me. Maybe that is a short form for impressing others. So that's IMPRI. That's how I look at, because every topic that they bring out It is very nuanced, and they have like a galaxy of people who are experienced, who come together to form a string, which makes a huge impact when we leave this webinar. So I would like to thank them for that, and Professor Vibhuti Madam, because this is one topic that can have different strands, like Professor Sanghmitra said, but when it is woven together, it makes a beautiful tapestry of approach which you can look at it. It gives a huge umbrella to look at, like it gives a coverage on those aspects, different nuances put together. So it was a beautiful book to go through, and I'm happy that you have asked me to express of my ideas about it, because when I went through the book, it was as if the research that we are doing right now in school children, which is a participatory action research, having triads of children, their parents, mother, father, and school teacher. 3 of them talking about COVID and how it impacted. And there's one version by the parent, one by the child, and one from the teacher. And when I see Madam's book, it is like it's the same thing that is going to be enacted, because she knows into it. She has immersed herself into it, and she has come out with those pearls, even though we have not completed, but we can see what it is coming through, because the lived experience of the participants is prescriptive. And many a times when we look at gaps, it is those stories that are directional for them. So starting especially when we are holding 114th rank amongst 142 countries in the Gender Gap Index, there's a huge scope for us to improve. But are the policymakers listening? Are they interested really? Or are they only interested in showing a sticking plaster and calling that the treatment has been done? There is a difference. Whether you want to heartily engage and go to the root of the problem and then try to come up with the remedial measures, than show to others in a way, in a flourishing style, that everything has been attended to. So I think for those who wish to do something positively, Dr. Vibhuti Madam's book, An Intersectional Gender Discourse on Empowerment During the Pre- and Post-COVID Pandemic, is really directive. And I also notice when you talk about children to old age, the different levels at which COVID impacted them. There was huge discussion in my own department with our own colleagues, and they in fact tried to tell me that men have suffered more. They have died, in fact, mortality is much more. But I would say those who have been finishing their life and going away, but what about those who have remained? The morbidity, the suffering, the lived experiences, the literally crunching of their day-to-day exercise with nothing in return. So isn't that also to be considered? And isn't that not a greater harm? Because the burden of carrying on without a breadwinner, but not being paid adequately for the same amount and much more, and to have your entire care burden ignored, as though it is your right and you should be doing it, or it's your fate and you should do it. And when it comes to return on investment, very proudly, when people say we invested, we got this, but you have invested into a household, a mother, a sister, a grandmother, who till the time they go to the grave are literally serving to the family. But these go unsung. So that is where I thought Madam's specially approach with what happened during the COVID, even on the young girls, on the gender-based violence, and they had nowhere to go. Abortion centers were closed for a long time. And when it were opened, they didn't have access, the buses to go there and have that. So as a result, a lot of unplanned pregnancies, a lot of unplanned marriages as well, incestuous relationships, as well as child brides. So now it is not a one-time story, but it has its own ramifications. Because those girls who were pulled from school and got married, now when they take up the helm of the family, and when family ill-treats them, they have lost their voice, because they have lost their economic capability. They would only be able to take up a maid's job or something. Otherwise, they would have got a better opportunity for the human flourishing, which they were deprived of. So it is certainly a shadow pandemic, where we look at in depth of it. When we have a reparation mechanism, we should also think of how best they should be supported through the schools. So what if they're married today? It doesn't mean their dream should be totally crushed. So that's one more thing, and especially when it comes to Sustainable Development Goal 5, the direct efforts of the state and the non-state actors. There should be a huge mechanism, and it should start showing its effect right from school to nutrition to making job opportunities, to have a group of individuals to see what are your dreams and how we can help fulfill them. So it's important. Secondly, what we also noticed in our school, this thing which Madam has very nicely depicted, is internalizing inferiority complex. Because many of the teachers also said some students were brilliant before COVID. And after COVID, they don't open up. They don't speak. And they're just, okay, fine. Their face is like a deadpan expression, which suggests it's like a post-traumatic stress they're undergoing. Unless we have a nuanced approach as to how to get them out of it. What can we do to bring the spark in those eyes? So it's something that we need to really consider. And when it comes to especially the work that is done by ladies, they do not have enough support system even amongst them to make a call. If a lady is talking to another, soon you will hear the comment that, why are you wasting your time on phone? Go and do something. But that is not a waste. It's a catharsis where you always find about the care of another. You talk about it only to their friends, and then you get a kind of consolation by opening your heart. So it is something that in a family structure, communication with a friend, it should be encouraged and it's important, but so much of importance is not given by the other sex. And the plight of the transgender, especially during COVID-19. Of course, I also say low socioeconomic status, where they were literally waiting for meal at the doorstep. And then some of them did not even access medical care because when they went there, the meal would go away. They would not get anything. And when we have directly held talks with the transgender people, our hearts have melted because we thought there wasn't enough empathy from everyone to find out, or at least significant ones, maybe whatever were in a position to find out what went through them. Because after 1 month, the rents were increased for them. Either you leave and go, or if you want, it was doubled. And overnight, they managed to pay money through loan sharks. Until today, they're still continuing because of the compound interest that has gone on it. So that is how, when we look at a kind of violence that went on them, it is not at any level, any age was exception. Whether you were a fetus in the womb, or you were newborn, or you were a young girl, you were a teenager, you would not get a sanitary pad because it was not on the agenda. It was very little resources to go around, and people concentrated on food than getting your sanitary pad. And similarly, there wasn't enough expression for them to go ahead and seek help, even in case of sexual violence, gender-based violence. We had only skeletal services. If you had COVID, you had everything. Any other thing you had, it wasn't even worth mentioning. If you were delivering, don't come to this hospital because there's only COVID. Go somewhere else. So the ladies that came faithfully to the hospital where they took an antenatal check were not admitted there. And many of them delivered in the auto rickshaws. Many of them had a cord around the neck and they had complications. So these are something that we need to look back and say, what kind of a better world are we planning? And Madam has beautifully written about the remedies that need to be adopted. And especially when it's all inclusive nature of education and addressing the social inequality and giving them some recognition or a power to make decisions, where sometimes it's only male who sits and make decisions. Even at the apex bodies, you find a lot of men trying to plan how it should be for females, how it should be for ladies. And ladies' representation, although it should be said 30% or whatever, is still lacking. In fact, when I took up a job as a lady medical officer for postpartum center, that means contraception advice, there have been men before me in the job of a lady medical officer. It's not that ladies are not around, but the question is, jiski kathi, uski bhains. You have a power wielding capacity, you get it. So that's somewhere women are excluded, and it is not necessarily they're not willing to contribute. But some opportunities are deprived because they don't have a political support, or you could say the big people supporting them. So these are some of the things beautifully done. I really congratulate Madam for this book. And also the concluding remarks that across different ages and groups and regions and communities, we need to still think how best to bridge this gap. So understanding this gender-specific initiatives impacts are very crucial, because I thank Vibhuti Madam because she's also our visiting professor and she inspires us. Before she came and taught us, we were looking at gender like gender ethics lens. But from the time she's teaching us, we are more gender sensitized in different ways, a ramification how gender goes into. So I think I thank her on behalf of Center for Ethics as well. And thank you all, ma'am. I'll be listening to you for quite some time. So thank you so much. And if there are anything I'd like to answer in the end, if I'm here. Thank you.
Thank you so much, Professor Vaswani, for bringing in some very important points to the fore, particularly when you point out the whole life course of a little girl till she becomes an older woman, and the realms within which, how COVID could have been impacting, whether you were in the womb or you wanted to be at the ANC center or deliver the child, etc. And we've seen it through happen one after the other. You were locked in the house with the person with whom you weren't conducive enough to live. You were getting battered, but there was nothing that you could kind of communicate to. Like you already pointed out, how communication were being stereotyped, time waste karna and things like that. So I think you've put it all together very well, and I'm sure there'll be some observations in what you said, and we'll hope that you'll be able to stay with us for a little longer than what you think. But of course, we do not want you to stay back, because you already have that's equally important job that you're supposed to do. But thank you so much, ma'am, for bringing this on board, because when you look at women, particularly in the hospices, and when you talk about the vulnerable women who are already in work, etc., if I may draw from what we've been looking at in terms of women who are engaging in hospices, in their cleaning occupations, the bedpans and the drains and the syringe and all the refuse, it was very, very obvious that one, the work hierarchy was very, very visible. Who would get the equipments first versus who would get later, and then what will be the outcomes of those. So I'm sure the umpteen stories that we would have in each segment of what Professor Vibhuti Patel has kind of collated together through her articles into this book. So thank you, ma'am, for bringing that for us. Some of the stereotypes which you have brought in, I'm sure will ring in our ears as we listen to the other panelists also. Thank you so much, ma'am. I would then request maybe Dr. Swati Rani to follow and make her observations, please. Over to you, Dr. Rani.
Let me first thank Madam Vibhuti and congratulate her to bring such a beautiful piece. I'm a hospital planner, so I always say, everything under one roof, that is the best hospital. So here, when I saw this book and I saw the chapters, it was like, it was like a gift I got in my hand, because I being an academician, a nursing researcher, now working for nurses, doing advocacy related to the gender perspective, I was looking so much for such articles which would inspire me, which would make my things clearer on the gender aspect. And the lens what she has used are so empowering, because things which used to be only in my mind, the questions, now I have a complete set of articles, international articles to refer, where I can quote, where I can fight my advocacy movements with the people who tell me that, ILO doesn't say this, or the nation doesn't have this part of the code, or the sexual harassment thing, which is so much predominant in healthcare sector, which is so much under the carpet. Now I feel that, I'm more empowered to take this to my fraternity, nursing fraternity, and ask them to read this, because gender is such an important aspect in nursing. And we, during COVID, had literally seen it, how the vulnerable students, the nursing students, were asked to go and take care of the patients when they themselves didn't know what is COVID. and how these students came to me asking help. The teachers came to me because there was nobody in the hierarchy where they would go, and they didn't know how to do the advocacy part. And me being a part of Jan Swasthya Abhiyan, I took these issues to the core team, and where they helped me to go to the journalists, because they were the only ones who were bringing the news in the media, and how we fought against such a important thing, because the nursing students were very vulnerable, and they were asked to go and take care of patients without N95 mask, plus no PPE kits were there, and the nurses were asked to go and take care of the ICU patients. Okay, and how the nurse stood that first we will take care of ourselves, only then we can take care of patients. And for that we needed so much of efforts, and what you say is most important is support. We could support the nurses and the healthcare workers directly from sitting at home. Because we were not allowed to go out. The first COVID thing was very difficult because nobody knew what is to be done. And suddenly, because of lockdown, the whole healthcare system had come to collapse. And because of that, most of the nurses were asked to come on duty, and they were not given a permission to go back. And if they were going back, they were beaten up because of the scare, and how these girls were completely vulnerable, and that brought this gender issue on my face. And as a nurse myself, I felt that I have to work on the advocacy movement for the nurses, and that's how the advocacy movement started. I had to close down my healthcare consultancy, which was more on the private sector, and I only work now for nurses advocacy and patient healthcare with the help of Jan Swasthya Abhiyan. And I think there is so much to do, and we need a lot of support from the women organizations, from the women's studies, because nursing is still under the umbrella of the medicos or the doctors, and still they are driving the whole nursing profession, and we are not able to identify us more than a patient and a bedside. And I have been telling to my nursing profession that nursing is more than bedside. We are not. Nursing is a social profession. It is not just a medical or a nursing profession. And I thank Vibhuti ma'am, because I attended her gender course, which was with Vina Vaswani ma'am, and it literally broadened my horizons. And IMPRI has helped me to broaden my horizons more by creating so many webinars on mental health, gender. And with that background, I would like to just present my topic.
Disconnected because of my poor connectivity. Hello. Sorry, I got disconnected in between because of my poor connection. Sorry for that.
So I'm just going ahead with the slides, which I have already presented in my talk. So my first expression book was, it is an ebook, just 166 pages. It is like a pocket book, you can refer it. And I think each and every person should buy this book, because it is a Bible for all women, wherever they are. They may be in education, they may be in healthcare, they may be anywhere, to the policymakers. So it is like a Bible which we all need to have if we want to see the progress of the nation. And the progress of the nation happens only when women and men work together. And we all know what ma'am has the capacity. She wears so many feathers she has in her cap, and she has so well analytically made all the points. So many points are there with so many lenses she has brought to us, which we heard from the previous three authors, from the author also, and from the previous speakers also. So this book is really a treat for all of us who are struggling to understand gender. So the strength of the book is it's very lucid. The language is English, and it's a very lucid. You don't have to be a gender specialist or academician or somebody, who has to be very well qualified to understand this aspect. Anybody can read it. You have to only understand English. So that is the best part of the book, I felt. It literally took me back to the experiences of COVID when we were sitting at home and fighting for the healthcare workers and the patients. And it made me relive the history. The book is so lucid, so I could say that, now all the academicians should use this language, because it becomes so easier when the language is where, where you can touch to each and every person, where you don't have to be an academician to understand the framework. When the word framework used to come before my PhD started, I used to get no sleep, what framework, what ethics. And now, I feel that this book doesn't have that part at all. And it's very well, when we read this book, we understand it very well. There is a reflexive mind, and we get much food for thought, because we now we relive the experiences and we understand it more with the gender lens. It's an evergreen book. This book is going to be evergreen, and thank you, ma'am, for that. The best part of the book is that it has brought the gender response budgeting. When I was fighting for the gender budgets in Maharashtra, and when they asked me what is the nursing budget, and when I went back to the nursing leaders to ask them what is our budget, nursing budgets, they said we don't have any budget. And so if you don't have a budget, how are we going to have things for us? Who is going to even look at us if there is no budget? So that was a big question mark for me, that our nursing leaders are still not aware of these political issues, how they are wrapped up so well and kept away from us. So healthcare workers have to understand the paid work and the unpaid work, because for us, every work is unpaid. Or you can say the paid work, we don't know, because nursing itself is a noble profession. We don't know where to stop giving care, where to say that this is paid and this is unpaid. So the nurses are the most burnt out, or the doctors are the most burnt out, and they were the ones at the front line who had to face the music of beating ups. So many doctors were beaten up. So many of them have lost their lives. So, and the women doctors had to manage both their house and the patient load. So it was a big task, which this book has very well showed us. These are the few pictures which we can see how we were 3 years back, how these nursing students were forced to go and attend patients, and how the migration happened, and the nursing, the PPE kits were not there, and they had to work 20 hours in their PPE kits. So how much infections they had, how much dehydrations they had, how many of them have lost their lives because of infection. My best chapter is the first chapter, because I deal with many youngsters, young nurses, young students, and I teach in various public health schools. So where it's very important for me to reach them and make them understand that you are going to be the leaders in the society, and you are the ones who has to understand this gender base. The best part of the book is that it has very well revisited the SDG purpose, and the values are so well mentioned: freedom, equity, equality, human rights, solidarity, peace, security, tolerance, respect for nature, and shared responsibility. These words are so important, but we have never heard them in the normal policy making. And that is what I want the policy makers to think on these words and then make your policies, because these are the actual way to bring the policies where it will help the nation and help the individuals, especially the women, the girls who, many of my students had to stop their schoolings during college, and they had to get married, because these were from the vulnerable areas like SNDT, where they had started good courses, professional courses for the young girls who had graduated. And then we understood that in the first COVID, they had to go back to their own villages, and their parents were asking them to get married because they couldn't attend online courses. There were no net or no phone given to them. So this was the very pity thing, which as a teacher, I had a lot of pain, and I had taken all these things firsthand. So this is very well mentioned in the book. Then also the gender gap, which we saw in the education, then reproductive health. As a nurse, it was very painful for me to get calls from the villages where they were asking us, give us ambulance because our our daughter-in-law or our daughter is in full labor and there is no way we can attend, and most important, the auxiliary nurse midwives or the ASHA workers used to call us and they used to ask us that we don't have PPE kits, we don't have N95 masks, and the people are beating us because we are coming and they're saying that you're spreading the infection. So this was the vulnerability of the healthcare workers. Then we also saw how the domestic workers who were working with us couldn't come for work and they wanted to have money and we were supporting them, but not all were getting support. They had to walk back to their villages. Definitely the farmers part is very well covered. Then the part is that the impact of the neoliberal economic policies. So these terms are very new for the nursing background person or the person from the medical background. And this is so lucidly brought by the author, I can say, that how it has emphasized the shift caused by the liberalization, privatization, and globalization. And today we can see how the corporate hospitals are making the profits without thinking about the patient safety. Okay, so this is so much important. This new economic policy is must that a nursing syllabus, a medical syllabus should be taught, because we don't know, when we are working for a private sector, we're thinking, wow, the hospital is so good, but we don't know what impact it is causing on the nation. There are so many good recommendations, and I feel each and every policy maker should use this book as a Bible. And when you're making the national programs or the policies, you please use this book and use the lens of gender inclusion, which is so much important today. Healthcare, you know that 80% is delivered by women and 20% men lead us. Okay, so who should be taking the lead in decision making? It is the women, it is the doctors, the nurses, but we are not there at all in the parliament, nor at the state level. Even the task forces were not having women nurses or women doctors. All the task forces were men. They were the ones who were running the show. And that is a very painful thing, I feel. The conclusion, each chapter has a conclusion, and the conclusion is so well thought of from all the angles, from all the lenses. And that part also, if we start the public health policy makers, the public health students, the teachers who are teaching public health, I think this should be our Bible, because it's so well written. So now I feel that somewhere in the next edition, I think healthcare workers, the unsafe conditions of the healthcare workers should be brought by Madam, and her thoughts, because she has done a lot of movements with the nurses, with the ANMs, and that part is not very well present in the current knowledge. And that part I feel ma'am should add, so that we know how to lead ourselves to bring healthy working conditions for the healthcare workers. That's one part which I would request ma'am to add. And with that, I end my discussion. Thank you so much. And thank you, IMPRI and Dr. Arjun's team for bringing such a wonderful book to us. Thank you. And thank you all the speakers and Professor Acharya for giving us this opportunity.
Thank you so much, Dr. Rane, for flagging in some very important elements which are there in the book. And, sometimes we read and we don't really capture those. I think you flagged some very important things, two of which I really want to reiterate at this moment. The first thing which you pointed out in terms of how the domestic helps were being, discriminated, and that's what brings me to the idea of during COVID. I think we divided ourselves in terms of we who thought will be getting infected and we who were the providers of services, right? So as provider of services, we were struggling to make that space for ourselves to be able to provide the service, and we as the people who may get infected, etc., we are trying to be very, very conscious and let people from outside not enter the buildings, cordon them off, they can't use the same lift, etc., etc. So I think that was something very important that you really pegged in. And the other was, I think, you brought in, you alluded to what were the problems of the nursing fraternity. And I think that also poses to us and makes us think about the contractualization of nurses.
Yes.
To my mind, I think it was because they were vulnerable in their work environments. They could be prodded to do certain things, which perhaps those, have they been not in the contractual positions, they could have been in a better position to kind of be assertive about it. So I think that was another thing which you flagged very well. And the third was when you talk about the privatization, or rather the public care coming in terms of, making the kind of money they made. And it's more than evident, till vaccine happened, we didn't see private sector anywhere. The moment vaccine came in, you knew that the private sector is there because that's where the money was. Till then, private sector was just shoving you away, whether it was delivery of the child, birthing the baby, or anything other than, so it took a lot of time till the government stipulations came in that, okay, as a private hospital, you ought to be giving a number of, allocating certain services. So I think that really brings us, and in fact, that also connects to what Professor Vaswani said in terms of the plight of transgender. I think vaccine and vaccination was something which transgender had to face a lot of problem, because the centers weren't equipped to identify them as male or female. So I think it was still about December or January till it actually, became accessible to them. So thank you so much, Dr. Rane, for bringing these points. And I'm sure there are plenty of others, which I'm sure we'll hopefully get time to get back to those. So with that, thank you once again, Dr. Rane. And I would request Professor Aravinda Ansari to come up with her observations on the book. Professor Ansari, over to you.
Thank you. Thank you so much. Thank you so much, Professor Sanghmitra. And I take this opportunity to, thank Dr. Arjun Kumar, the head Team IMPRI, and other members of Team IMPRI, and all my co-panelists, and of course, Professor Vibhuti Patel, for this wonderful, I would like to congratulate her for such a wonderful, thought-provoking book on intersectionality of gender, discourse on empowerment, and thrashing out certain issues which really need academic attention. With the permission of Professor Sanghmitra Acharya, who was a very dear friend, I will try to weave, I think almost most of the things have been covered. So I will just see that how, I bring in my thoughts about this book. One thing which is very important, which, we talk about pandemic, is that, of course, displacement and disruptions were a very, very important part of and the book also talks about migrant laborers, that how, they were dislocated, and this displacements, and how it impacted them, and how the lives were disturbed, and there was a lot of distress, and distress was felt by all of us, but women being, the most vulnerable victim, no matter what class they belong to. Yes, intersectionality of caste, class, region, ethnicity was very, very much pervasive, and that is what Professor Vibhuti Patel has also tried to talk about in her book, where she talks about women from minority communities, how they had to bear, and how they were impacted so differently, in pandemic. Now, very important thing which really impressed me about this book is the last 3 chapters. If we look at the book, the organization of the book, it is talking about the pandemic, the way it displays distress. Then it is also talking about, through the lived experiences, then it is also, talking about the challenges which we have. The challenges, the second part is talking about the challenges and how do we balance, our very important sustainable development goals, and the goal which we have, a gender equal society by 2030, is she's also bringing in that, all these goals, especially about hunger, education, nutrition, infrastructure have become more challenging. What we were trying to address, but these 3 years of pandemic have made us stand on a threshold where we see that these goals are are getting further away from us because of the inequalities, and pandemic has kind of intensified the existing inequalities. And last 3-4 chapters are talking about the way forward, which is Professor Vibhuti Patel has done a wonderful analysis and has brought in what actually feminists have demanded, that how and even the various reports on reports, for instance, the UN Women report, which he is mentioning, has talked about that, what implications it had specifically for women, and what kind of remedial measures we want to take, and what should be the new normal. Now, what pandemic. Now, the World Health Organization say that it's over. We don't know whether it is over or not, but now it says that it is over. So if it is over, so what is the new normal for us? Social distancing was something. And to my mind also, when we talked about social distancing, when we have such stark poverty in our country, I have seen people, reusing it or using masks as a tokenism. I have come across many, safai walas and other people who, they had to take a parcha from the thana so that they can move. So they will come and they will say, mask de do, phir usko wapas rakh denge, because that 10 rupees. State announced, social distancing, use of sanitizers, use of masks. But a person who has a very, very meager income, for that person, there was no provision, no foresight for such, making such arrangements. This is one very important thing, that we adopted the policies, and without having an infrastructure supporting to them, and that lapse still continues. When we talk about inclusivity, we talk about yes, inclusivity is one of the best provisions, but what I am seeing, maybe Professor Vibhuti Patel would respond to this later, is that it is more add and still approach. 75 years of independence, when we are talking about Amrit, Azadi ka Amrit Maha Utsav. What is this rate of women? Violence against women. It is increasing in pandemic. We have not tried to capture, there have been many attempts, but that violence, what you were also talking about, violence from intimate partner, encroachment of spaces, losing jobs, going through social, psychological, physical trauma is also very, very pervasive. And somewhere I also feel in this whole discourse, what about middle class women? For her, the line between the work and home has been blurred with this new normal, this digital world which has come up. If I talk about my experiences and your experiences as a teacher who immediately overnight had been asked to shift to technology, and thinking that the technology and that would make our job easier. In fact, knowing technology was a challenge for us, for teachers, for middle class professional women, and also for the students. There were again the question of class, access to digital devices was also there. But imagine blurring of this boundary between work and home. So we became 24/7 workers. What happened to the rest time? What happened to the me time of middle class women who have to juggle with these challenges which have come? So yes, we need. Very important thing is that we are problematizing the question of hunger, infrastructure, and we have seen the COVID very starkly brought forth the condition of our health facilities, the health infrastructure, along with unemployment, and the way women have been thrown out because they are first to be fired when it comes to ad hoc jobs or temporary jobs. They are the first to bear the brunt. And also, when we were talking about sustaining domestic health, that was again a big challenge, for women, that sustaining, yes, we have made recommendations, but what remedial measures state has for meeting such exigencies? Feminists have been demanding that we have instances of earlier pandemics, Ebola, and what, in fact, another pandemic which Professor Patel has mentioned in her book. But we have not learned our lessons from them. So, I also feel the present situation, the question of education, hunger, nutrition, infrastructure, and justice. Justice has become a very important question. I internalize guilt when my family member is not able to get help. And it was a very, very important, fortunately, unfortunately, women have a stronger immunity. Biologically, they have a stronger immunity. And they were the caretakers in the family. And yes, of course, your fight for getting medicines, your fight for getting oxygen cylinders, and also getting food for your children became very challenging. It is that, another very important challenge which we should look at, women's economic, there is a challenge that they are losing on jobs in unorganized, and it's established. But with that, many more women-headed households have also emerged during pandemic. So how are we supporting? What are state measures to support these women-headed households where they are unskilled, uneducated, are important questions. And, I was thinking such a wonderfully designed way forward where, there are 10 points where in the conclusion, Professor Patel is talking about the remedial measures which could be taken so that we have a better tomorrow, we have a better world to live in, where we, have equality, cultural pluralism, along with, protected environment and other issues are addressed. But where is there a political will is also a very important question. My fear is that we have so many legislations. If you look at violence against women, we have so many legislations there. But I don't want to sound pessimistic because a lot of work is being done there. But we have to have more engagement at civil society level, which is very important. And during COVID, we have seen the engagement of civil society organizations, civil society itself, people coming out independently. And I think that is the very important reason that we were able to survive pandemic, though it had done drastic damage to our society. But that sociality, that sociability is so important for us, and we need to preserve that sociability. In fact, physical distance was fine, but social distance is something which was more damaging. And we to break down that culture is again a challenge. It's a challenge for a middle class women like me, where my children have not been to school and colleges, and they were all the time hooked to their iPads, to their phones, or to, they had. So, but it has done, this is again a challenge. Now, we don't count this as a challenge for a caregiver, but it is a challenge of a mother, that how she would, help her child to withdraw from such addiction. If we look at the reports, the media addiction has gone much higher during this period. Now, this is again a very, very big challenge. The relationships have shifted because, though I still, I have a strong belief in our society, the composite culture, the collective wisdom, and the solidarity, which is there, which helped us to navigate this crisis. But, somewhere, we have also laid down the foundation of individualism, where we were looking after, we were kind of trapped into our own homes, only thinking about the welfare of our families. So, this is something which is which is still, when I'm looking for answers to these questions, and I'm also looking to the answer to the question that when we talk about gender parity, gender equality, yes, what Professor Vina Vaswani was talking about, the problems of transgender. The way, they were the first to be thrown out of their livelihoods. No weddings were happening, they were not engaged, and state has never come out with an alternative policy for their engagement, is something which is very important, and we need to think, because we see already that there is a lot of unemployment, their livelihood, their traditional livelihood has been encroached by modern ways of celebrating marriages, births. We have more sophisticated ways of celebrating these, and their roles have been completely eliminated. So we see already trafficking, beggary, sexual exploitation is on increase in this community, and this community invisibilization of transgenders is also a very, very serious concern. I think we need to address, and I think I congratulate Professor Vibhuti Patel for such a wonderful work, where we have been very intellectually and scholarly told about the issues, challenges which are there, and the way forward. And rest I can answer any questions. Thank you so much. I hope I have, managed the time. I've not exceeded my time later. I'm sorry if I have exceeded.
Thank you. Thank you so much, Professor Ansari, for giving yet another dimension to the discussion that we've been having on the book. You really flagged a couple of very relevant, aspects, if I may say, particularly when you were pointing out how media has kind of, young people have got hooked on to various forms of various gadgets, which are, bringing them close to the media. At one time point, to restrict screen time for the children was the norm. Come COVID, we as mothers perhaps made the children sit in front of the screens because they had to do classes, this, that, and so on. So weaning them off is now become a problem. As soon as we bring in girls, the first stipulation was that do they have access to the phones? A lot of them we know did not have access to phone, for reasons being ladkiyan bigad jayenge phone hone se. When I was with one of the universities in the eastern UP, and we were talking about new education policy, wherein girls are being equipped with various kinds of ways in which they can be inclusive education for girls. And here are the parents saying phone is a no, even if they have to go on online classes and all. And that's where perhaps, one of the comments made was that the online classes, however much we might want to feel good about them, they've brought in the classroom to the kitchen. The girls' priority became the kitchen, not the class which was happening online. So thank you very much for bringing in that element. And I think that also raises, very neatly connects with the idea that you said, the individualization of each one of us. And I'm sure we've seen this happen in the school, in the classrooms that we've been engaging with. The students became those boxes in which we were seeing their faces. They didn't interact with each other. They didn't know what was happening. So while we are worried about, the anxieties that the students faced, I think even on the other side, as teachers, we had our set of anxieties, which you very rightly bring in when you're talking about the communication, perhaps, which was so very important to happen across, perhaps offline, from the face-to-face kind of realm. So thank you so much for bringing in that on board for us. Keeping the time in mind, we still have two more speakers to speak to us, tell us about the book. Thank you once again, Professor Ansari, and I invite Professor Mani McLeod for her observations on the book. Thank you, ma'am, for being here with us. Over to you for your observations.
Thank you. Thank you very much for conducting this as a chair. And I thank IMPRI for this opportunity and also helping Vibhuti to bring out this book. I congratulate Vibhuti. Already I did that, and I join with others also to congratulate Professor Vibhuti. It is definitely another cap on your feather. And it is a compilation of articles, but still bringing all sorts of very important and essential components to deal with the title, and as such, justice, do justice for the title. That is, you are bringing both pre and post and gender and intersectionality. So as such, the piece of work with gender and intersectional perspective, though there were many documents and publications on the COVID impact, definitely this would make a difference in the sense that it is combining, on the one hand, not much on gender discourses, and connecting with the intersectionality is again a contribution. And that way, I join with others to appreciate. And better we use the term physical distancing, not social distancing. And Vibhuti herself has pointed out that, because we are already distant, and we need not have to use that at all. And coming back to the flow, which the book is helping and providing the inputs, I joined with Professor Acharya and others that it is definitely giving us a kind of guidance. It serves as a guide, I should say, for any disaster. For that, the process involved has been well described, and therefore any stakeholders for that make, whether it is an academician or researcher or a policymaker, or for any stakeholders concerned, can have this as a guide to understand the process of intervention, recovery, relief measures, etc. Because that is what Professor Vibhuti has described in detail. And though it runs to 166 pages and 12 chapters, but still she's very elaborate on several aspects, and reinforces on the very essential aspect of the book is intersectionality and the vulnerability, the marginalized, whatever. So I don't think that anybody will be competent enough to list this section of population to be listed under the marginalized or vulnerable community. So exhaustive, or whatever, even the kind of areas in which the impact, she has been very complete and exhaustive, and giving very less scope for adding any. So that is one perspective in which I look at this book, and she has been very comprehensive. And it is also, anybody can read it, very simple, self-explanatory, and definitely inspiring, motivating others to write also their own experiences. I also felt so, definitely. I myself was like Vibhuti, we were all involved through this Indian Association for Women Studies. Everybody in women studies, usually the academician come activist, and therefore you can't be silent when such things are happening, and therefore you also involve yourself. So that experience should be brought as a book, that I myself felt. And on the 12 chapters, certain important areas she highlighted or emphasized, I could say, the informal sector work. That is the major concern, because on the one hand, it is essential in the existing development process. On the other hand, during the COVID, they were the worst hit. And therefore, increasingly emphasis has been paid to talk about in different areas. Though a chapter is devoted there, she has been talking in other areas also. And given that there's a declining participation of work among women, it's already happening for the past 2.5 years, decades or so. And the pandemic really hit hard and rendered the vulnerable there most, particularly the women. So what I felt was like there is a need to kind of documenting the experiences of whoever contributed on that area. And as she rightly pointed out, that the impact is not homogeneous. It had a differential impact on different people, but women in the marginalized communities of the listed items, I could say, right from whether it is the working class women, the agriculture sector women, the rural women, the minority women, and the Dalit and caste class, region-based women, definitely there will be differential impact. And I also add with Renda's the points raised by Professor Ansari also that the middle class women, particularly working women who are hiring out the labor outside, coming back and balancing or sitting back, doing work from home. And the shadow pandemic has been happening in respect of the gender, and there were calls. So all these could be well documented and presented, and it will definitely give a understanding as to what is the process in which everything was handled, what was the issue, how it was handled, what were the gaps, and how those gaps could also be attended. See, this is what I see in the books. And when I was going through the kind of impact on different workers, like migrant workers, we all know the worst hit section of the population. And it was observed in our own surroundings here in Tamil Nadu context that the digital divide was one, which was also pointed out there. Like the girls always give up, like boys and girls are there. Even whether it's a younger brother or elder brother, the girls give up if there is only one unit, the device, the mobile, to attend the classes. And if the girls go and join with other girls. It had happened to my own students, PG students, though they did not use the device which they had at home, but they went and the neighbor. Of course, the facility must also be there that classmates would be sitting together or staying in the neighborhood. So that is one concern. Of course, we are talking about even the recent budget also, digitalization, connecting the villages, etc. But you have to have the infra. So that was first hit, and during this pandemic, that was well articulated by Professor Vibhuti. And the migrant workers, the kind of relief measures and the in a gender perspective, she used the gender lens to describe the vulnerability that the migrant women workers, some of them are pregnant, some of them must be on their periods, etc. And they were walking down for miles together. So the camps also and other areas, how much these women. So only a person who's an expert in gender and seeing everything in a gender lens could present all this, and Vibhuti did justice for that also. And as far as the working class as such, I could point out certain kind of work where I myself directly involved, like construction workers, domestic workers, garment workers, etc. Textile and garment workers. Of course, you know, Tamil Nadu is leading, and after a lockdown, 50% of the workforce were inducted, and it was not only 50% workforce, it was also 50% of the wage. So many were working more than 12 hours, because we had side-by-side discussions also, people complaining, and the kind of movements emerged among the CBOs and also NGOs working. They could organize discussion programs, and therefore it was brought out well by the very workers themselves. And therefore, of course, we understood the kind of issue they have to also survive, and therefore, but it was continuing for a long, and that had to be taken care of, as they cannot go on and on. And of course, the return migrants also joined back because could not sustain. Most of this in Northeastern, North Indian workers, they were here in Tamil Nadu. It was reverse migration, as pointed out by Sanghmitra, and they had to come back immediately, except some domestic help workers, etc. And for the domestic workers also, what happened, it was like totally withdrawn, and they were not inducted back at all for the fear of the infection, getting infected. And therefore, there were around 120 households in one particular area. Their primary work is domestic work. And some of them, as I already told, that we were also into public, and therefore they come to know and they contacted. And the worst point is that I was also got stuck by an accident, and I had to stay for 40 days with the kind of a sprain I had in my leg. And therefore, it was like, as somebody pointed out, positive and plus negative. Positive is I could not take leave. I had used this leave. But at the same time, staying on my bed, I had to mobilize people and even connecting myself with online discussions, etc. So this people know, they contacted me. So immediately what I did, I contacted media, thanks to other speaker also mentioning that. So TOI, Times of India, brought out an article about the sufferings of the domestic workers, and immediately they were pouring into some kind of support system, and they called me and thanked. At least for months together, they got some support, some organization or the other seeing into the notice. And we worked with several grassroots organizations, doctors, Gynecologists Association, and several other charitable organizations. They could help, including our own IAWS associates also. They were so charitable in donating, and we went with some NGOs to support. Colleges also joined, thanks to the university. The affiliated colleges will always support. And the frontline workers also, we did we visualized how they suffered. Some of the women, as here it was pointed out, that nurse, they were not allowed to go back, and how they suffered without seeing their own children, even the kids, etc. And community kitchens, the other sort of sufferings that these kind of workers, particularly as it was pointed out, contractualization, formalization, casualization, are all the features of these workers, and therefore there is no social security. And this was discussed, and there were kind of guidelines given by the author as to what kind of provisions should be made for these workers who are already suffering. And it is the plight of the workers is that they don't come to work, then there is no wage, and there is no other social security, even if they meet with any accident or something like that, though something in papers that is not being. And this has been taken for granted during this pandemic period. So whether they suffer any accident or health issues, nothing would be compensated by the capitalist, and that was the thing. So all these, what I try to suggest here is that definitely, that is what I said, some of the, whatever I mentioned, also experienced by and implemented through, say, various organizations. And one important, very important area is the sex workers. So sex workers won't be supported in this at all. So, but thanks to the progressive, the sex work includes the transgender, the HIV positive women, etc. So that is a socially, you could say, a subsect among the socially excluded. This is the major area, group where the support won't be going at all, because there is a stigma. And thanks to some of the NGOs who are working on that, and they could approach through us to colleges, and some support could go. So this particular, now we are talking about legalizing sex workers, sex work, etc. But the stigma is there, and therefore special attention needs to be given to those vulnerable. So this is one point of argument where it was well articulated. But only thing and only concern that I would like to place here is that though the entire work has been based on the participatory research approach, the very experience that Professor Vibhuti herself had and involved, engaged in various movements, grassroots organizations, and several other, some of our own co-speakers also mentioned that you are associated with. And those practical aspects could have been documented and added as a chapter, either as case study or even extra, the worst and the best cases of any area could have been also brought out. That is my concern. You have, based on the experiences, analyzed and presented, articulated, and even listed the exhaustive issues, whether it is recommendations or whether it is the kind of vulnerable communities or the legislations, the schemes, etc. You've never left anything. And this I felt that could have been added, and that will also be serving as a mark of contribution to the policymakers, or people, whoever is reading, will come to understand that this process has been followed. And it will also inform another component, that your experience will be discussed, and you have also presented here the entire experience in a book based on the participatory research approach. And people will get to understand as to how their own experiences could also be presented. So that is what I mean to say, and that could have been presented. And I prepared chapter wise some of the points, but want of time, and already it has been discussed by many. Only a few points I would like to make here, maybe about her concern over the youth, that youth, she is giving a clarion call that you should come together, and this is the era of youth, and the collective action by the youth community would be very, very well in bringing some kind of awareness and also proactive. The chapters, etc., the content you have done justice, and a lot of things discussed under the chapter heads. And she also addressed the issues of stereotype, saying that, advocated to introduce gender sensitization at a young age. This has been the kind of common suggestion, but it is not being happening. And even if it happens one time and people just leave. So that shouldn't be the thing. So right from school education, she has been suggesting gender sensitization should be part of it. And once you are sensitized, then you will do away with many things, and it is possible to take forward to achieve the SDG 5, that is gender equality. And also, she provides a way forward to build a society based on the foundation of intersectional gender justice in it, by listing the kind of intersectional variables affecting gender, or gender intersectionality with other variables, including class, caste, religion, region, race, etc. And the other fourth, the fifth and sixth chapters, special efforts and its impact, COVID impact actually starts from here. Earlier, she would be like talking about the SDGs and other things. So here, she tries to address the most invisible area of women's paid and unpaid work. I think she had a very huge conference, the international conference on this very theme. We have been discussing this, but unfortunately, even in Tamil Nadu, there has been an election manifesto announcement to pay 1,000 rupees for the unpaid care work, but it has not been implemented yet, though it is 2 years gone, for the reason that the budget is not there. So budget would be there for many other things, but the moment it comes to women's and recognition of women's work, etc. So in a way, it is, this particular issue of paid and unpaid work also discussed elaborately, and triggered by the COVID-19 abrupt lockdown, which led to the mass migration of focus, could be analyzed with the focus on informal sector and women's vulnerability. And also she stressed the urgent need for collective efforts of research, action, and advocacy with a gender lens in the area. Whatever all the areas she described, she was advocating this, and that should be followed by the policymakers. And the pertinent question she raised was like how it is possible to have what I already told, not social distance, but physical distance. The workers in metropolis, where nearly half of the population lives in the slums, how can they maintain so-called physical distancing when they are cramped in the small huts and rooms? So this is the practical question we need to really concern. But at the same time, she drew attention to the kind of social solidarity which provide. Though that is a period to be enjoyed also. Like on the one hand, it is a distress, but at the same time, the solidarity really gives strength too. So people were coming forward on their own and coming and extending some support or the other. And the other, the gray side is like underage, the child marriages were happening, forced marriages. So opportunistic, the people were opportunistic, and they were using this lockdown where the vigilance won't be there much, or monitoring won't be there by the welfare officers, and therefore it was happening. And of course, I join with others about the gender responsive budgeting. I don't have to say about what Vibhuti is expertise on the GRB, and it is kind of giving an exhaustive and comprehensive analysis of how a GRB, gender responsive budgeting, to be and how it has to be, and where you can find fault and how it is not implemented. Some areas it is being, some areas not. And she also claimed that the states can help to reduce the socioeconomic inequalities between men and women, between rich and poor, and between marginalized and privileged when the GRB is implemented. And it is like the final chapters, the 11th and 12th, were really kind of, as she herself claimed, kind of what would be the kind of prospects and problems, how it will be handled. And it would be like kind of a dream, she said. So where she emphasizes, enlarges on how to make gender equity possible in theory and practice with clarity, and change the might is right concept of the money-centric mindset of neoliberal market economy in these chapters. And she very much emphasized on people-centric, women-centric, child-centric, and elderly-centric inclusive approaches, and address the dynamics of profits during pandemic by US corporations and the heavy toll taken on elderly, poor, and marginalized. So it was like as a concluding remark, I could say, she concluded saying the last 50 years of feminist activism in India that have managed to challenge the 5,000 years of patriarchal order. So it is, we have to really think how to fight against the patriarchal order, just 5,000-year-old or more. And so by striking at the root of exploitation, oppression, newer forms of negotiations, etc., will only help to deal with the situation that cropped during the pandemic. So with these words, like I would like to end up with two suggestions. I already told that she can bring a kind of a case study or whatever form in which she, if she is bringing the other edition, whatever, definitely, wherein she could narrate her own experience as a chapter that will help in two ways to understand the process, and also for other writers to follow the suit. And certain areas are overlapping, which I feel that because it is a compilation of certain different papers, it is kind of overlapping, but it is actually taken to the context in which it is being discussed. And that oversight of repetition may be attended. That is the other point. And yeah, that is what I said. And there were different interventions by different communities also. Here, it is implicitly explained that these were the, of course, there are also limitations of pages, but at least some the best practices and worst practices also. Like we had several deaths happening with the shortage of oxygen. So these are all the kind of lessons you will be communicating to any other such disasters or pandemic happening. You have to be careful. So that selfless contribution of frontline workers. So any form in which the case studies could be presented and added to another chapter or supplemented in each chapter also would be enriching still. So this is what I want to conclude. Thank you once again for the opportunity. And once again, I congratulate Professor Vibhuti for bringing in a very comprehensive, elaborative, detailed discourse on the very title you have coined, justice, doing justice for the same. Thank you very much.
Thank you so much, Professor Manimekale, for bringing some very important points about the book. I know we are really short of time, but then I really want to thank you for bringing in what seemingly has not been elaborated in the book. For example, the context of commercial sex workers or sex workers in, I mean, if that's the more appropriate term to use. I think that's very, very important, because some of these vulnerable populations, vulnerable women, really have got wrapped and nothing much has come out about them. So I'm really grateful that you brought that up. And of course, the chapter which you think is important in terms of even the methodological realms, when you suggest that something to the tune of lived experiences, maybe the reflexivity which is so much required when you're doing a work of this kind. What have been the experiences of doing this work, putting all of this together? How did the author kind of herself overcome those issues? So thank you very much, ma'am, for pointing these out. I'm sure there are many more observations, but not eating into more time, which we've already eaten now. Dr. Sanghmitra Borua's, I'd request her to come on board and express her ideas about the book. Over to you, Dr. Borua.
Thank you, Professor Acharya. Am I audible? Okay. Thank you, Professor Vibhuti Patel, for bringing us this amazing, I should say, a platter, and a platter which has everything. And it's a rainbow platter, let's put it like that. And I thank IMPRI for making it possible for all of us from different parts of the country to come together today and to deliberate on the different aspects of COVID, and COVID that created, I guess, havoc in many fronts, in many ways, and also created some sort of silver linings in some ways. At least some books like this came out, and they can be also part of our reading lists. Now students have something to read, they have some reference. And when we talk of intersectionality, that was something which was missing. Because when we talk of gender, people would always say, okay, include women, let this be done by women. Okay, it's about women, you know, mostly it is that. So then I used to wonder, where will I fit in? Where do non-binary people like me fit in? Because again, transgender identity is legally accepted in our country, but there are many more identities which are part of the gender spectrum, which do not even feature. We are still under the kind of veil of a particular box that we have to fit in. And suppose we go beyond that box, an agender person, then there is nowhere to go or to move. So I'm being greedy, though I'm taking a lot of insights from what Professor Patel has put in this book, but I'm also being greedy and wanting her to dwell upon another chapter which would definitely include all these diverse identities and the kind of struggles that people have gone through. As simple as, you know, a delivery person calling up somebody during the COVID-19, and the person telling that you don't exist. I mean, because the voice modulation, you know, the person is dependent on hormonal drugs, and those drugs are not available during the COVID-19. So the voice changed from being male to female. So then the identity of the person completely goes for a toss. So even for essential items like dal, chawal, roti, whatever, milk, jo bhi hai, for everything, the person has to justify, look, I am this person and I am a he, I am a man, you know, these kind of struggles that transgender people, trans men, or even trans women had to go through during the COVID has been tremendous, and these things have not found space in many kind of material that we have come across. There are also issues related to, you know, the kind of support that they are given, the ghettoed support, that it is only a trans woman who would be providing relief material to the transgender community who are vulnerable. Other identity people are not allowed. So these kind of experiences we had when we were trying to reach out, or that we were trying to understand the vulnerabilities of the community. I'm very glad ma'am has put up this is in page number 13, where she's talking about allocation of funds for education of girls, women, and the transgender community must be utilized as per the budget heads. So this is already budgeted as far as education is concerned. But unfortunately, we are still struggling with, say, a gender neutral toilet. We are still struggling with a course structure, which is inclusive of all the genders. or which also includes the word queer, even including the word queer, because queer is an umbrella term. People somehow have got into this whole idea that queer means only lesbian and gay, or only homosexual relation. So that needs to be deconstructed, and that needs to be also challenged by all of you, in fact, in your own positions and in your own capacities in terms of the discourse, because that is targeting people, and that is kind of making people very, very vulnerable, because I understand the value of all the gender identities and the sexual orientation and the gender expressions. And we need to value all of it. And that is what women's movement is doing. And today, when I see the word transgender in Vibhuti ma'am's book, I feel the women's movement has really taken a big step, because this was something which was missing from the women's discourses previously, because I'm not undermining the huge struggle that women have already won in terms of so many things, you know, and in terms of being recognized as a decision maker in different policy think tanks and different kinds of forums. I'm not even talking about voting or getting daily wage, or not even talking about equal wages, whereas these are also still problems. These are also still problems in our part of the country. You know, if you're voting outside your family, kinship, outside the candidate that the family has decided, then you are being beaten up. You know, the woman is being beaten up. So these are stories which have already come in. Yeah. There was another word which was I was fascinated by, which ma'am has used, and I'm learning and unlearning, and that is deglobalization. So deglobalization is something which is very interesting, and that is something which might be a takeaway for me from this book, and to kind of contextualize it from the local or from the standpoint feminist perspective, you know, or indigenous feminist perspective. So from that perspective also I'm looking at it, how deglobalization might be understood, or how the queer ecology context might be understood. So in that sense, ma'am, I'm taking away that aspect as well. And all rest of the points, all the honored panelists have already covered. So I will not be repeating whatever has been already covered, but the points which I felt would be very, very useful for our students, and also the whole lens of intersectionality, that you have not left it you know, at all in any of the chapters, that it has been addressed and equally, and equal weightage has been given to every category who is still vulnerable, or who is still struggling with their identities, who's still struggling with their you know, gender, who's still struggling with their economic or social status, or who's still struggling with the kind of religious identities. So I think that kind of engagement is something which this book is giving us, and that is a kind of, it's a treat to students and researchers and scholars who would be definitely building on this discourse, and it's very, very handy. It can be carried forward. It is probably just a 2-hour read. You sit for 2 hours and you can finish the book. And it is something that we would look forward to many more versions, many more maybe, you know, chapters, or some more things. And some positive things which I liked a lot about the book is, yes, we have discussed about COVID, the kind of losses that we have got during COVID. And then ma'am is also kind of, you know, putting us into a peep into the new decade. So the possibilities. I think that possibility chapter 11 is talking about how SDGs can be roped in. Otherwise, SDGs and women means people only look at SDG 5, gender equality. Bas usi mein reh jate hain. So beyond that, we don't go. So I feel this book is trying to rope in all the goals, because gender is such a cross-cutting theme which can emerge in reducing inequalities, in infrastructure development, because if your infrastructure is not in place, definitely it impacts gender. If your sanitation is not in place, that impacts gender. It is opening up debates. The moment we started the gender neutral toilet at Tesco University last year, since then there has been very interesting insights and experiences of students, faculty, and ma'am has graced us also very recently. She had at our university. We are so grateful to you, ma'am, for being there and for guiding us and showing us certain guideposts that how can we engage with the concept of gender without intimidating some people, and in a way, because a lot of people get intimidated nowadays and it backfires. And the kind of problems then the students face more than faculty or others, the students have to go through a lot of trouble. So in that sense, I think your book is going to open up a lot of hope for people. So with this, I end my comments. I'd love to listen to more, and if there are any questions, I'd like to answer that. Thank you so much for this opportunity. Thank you, Professor Acharya, and thank you, IMPRI.
Thank you so much, Dr. Borwa, for being very crisp and very clear in terms of your comments on the book. I think you have done a wonderful observation by saying that it's a platter which is wholesome, very nutritious meal for the thoughts, which incorporate the SOP for anything that one desires to do on gender. And you very rightly bring up the nuanced sense in which we ought to be understanding gender, beyond the binaries that you started off with. I think that's very, very important. And this book very clearly brings that out and pegs it in a way where I think it just you can't just keep kind of getting there and trying to make an attempt to understand that. I think that was tremendously powerful way to put something which the book has, and perhaps would have gone unnoticed if you hadn't made this observation and shared with us right away. So thank you so much for that. I think almost everything about the book has been said. But if I may continue the organizers with my concluding remarks, I would simply want to take off from what Dr. Borwa puts this book as. Once again, the platter which is very, very wholesome, platter which is nutritious for our thoughts, to be able to understand how diverse issues when it comes to gender, understanding gender, they require us to engage with. So I think for that, we really are grateful to you, Professor Patel, for bringing this book in really that platter form. And I think a lot, of course, you've got a lot of homework to do now with all of us making observations, almost kind of telling you like school teachers, you've got this homework to do in terms of this chapter versus that chapter. And I think these are important observations because as perhaps colleagues, as academics engaging in such important questions, this is perhaps our own interconnectedness with each other in terms of propelling the work that we all are engaging with for enriching that work. So I think you really have done justice to the question with which you started, and in that process, there has been a tremendous enrichment of the field where we peg conversations on gender. I have had a chance of reading some of these articles in their original form. So when I was putting them together, when I was reading them in the form of this book, because I had to take this chair and kind of be here for this evening, I thought there were two things which were really coming to my mind. One was that I think Professor Vaswani and Professor Manimekla have already pointed out, you have knitted them also very well, so that when Professor Borwa says that this is a platter, on the one hand, we started with the tapestry, a beautiful tapestry of the ideas which tell us something about how we should be looking at gender, and we end up by calling it or understanding it as something which is so wholesome. So I think it really is, in many sense, the complete version. Swati has already called it the Bible, and I think we would endorse in that sense that it's fairly complete and will be enriched if the newer versions will have the elements that we've been discussing about. So the new normal necessarily has to be in the light of, I'm sure, the pointers in terms of what are the issues you've experienced by way of writing, putting this together, writing the articles. I'm sure you were so much engaged with what was happening then. Probably when you were putting the book together, you could have had a chance to sit back and then probably reflect on those moments. So maybe that really comes out fairly much in need of the next version that the book would, I'm sure, see. So we look forward to that, and I'm sure I would take this opportunity to congratulate is not really the word I want to use. I mean, that doesn't really convey what you really brought to the realm of learning about gender by way of this book. So it is really wholesome. It is telling us a lot of things, and it is also, and as the panelists have pointed out, the gaps which are there, and you could probably be bringing in one more gap, if I can just, and I wouldn't call it a gap, maybe a pointer you might want to consider since you're based in Bombay. When we are talking about vulnerable communities in common parlance, over and above the social identities, perhaps. Something which came to my mind when we were looking at a whole lot of social media telling us about personality A versus personality B, doing this versus doing that. What was coming to my mind was, as we were discussing this, in the film industry, what was happening to those people who were at the lower rungs of workforce? The spot boys, the chaiwalas, somewhere, so those of them who were at the subordinate levels. We've been talking about the plight of the migrant workers. We've been talking about the domestic workers and so many others. I haven't really come across anybody talking about these. I'm sure there may be, I may have missed it, but I just thought that this could be beyond the glamour. What was the life for them could be another edition. So we are all adding to your homework, ma'am. Sorry for that, but wonderful evening. I have learned a lot from your book, from your deliberation on the book, and of course the esteemed panelists that have kind of thrown light on this book. Thank you very much for bringing the book to us. Thank you very much, panelists, for really adding that nuance that the book could have, we could have done to this evening.
With your permission, Chair, I just wanted to mention one more thing.
Please go ahead, Prasan.
Yeah, this book is very good, and as I said, the last three chapters are telling us that what should be done, and there is a very exhaustive list of recommendations. But my question here is that we also need sit, because your engagement with feminist movement has been so crucial, and how do we make state to in fact bring into action more? That is also a major question. We have a list of recommendations, but how do we bring state, which needs our attention, that it has to be done, because law after law, recommendation after recommendation, if it is not translated into action, then we have to think about it. That how do we ensure that as awakened citizens, and what we said, that this whole, because yes, we experience collective solidarity, but how we nurture this, we see that it gets ruptures again and again. So that also we have to see and sit. I think this engagement is also very important. It's at two levels. Thank you.
Yeah. Thank you so much, Prof. Ansari, for bringing in that. I'm not too sure how the IMPRI is going to take this. We still have a session to do on Q&A. So I think I'll need your guidance in that. Do we go ahead with that, or what's the timeline, since we've already reached 8 o'clock?
No question.
Whether Professor Patel, would you like to respond or add your questions first?
Yeah, my response is that I accept all these questions, all the suggestions are extremely constructive. The condition in which IMPRI nudged me to compile whatever I had written was said that we were directly involved in the various grassroots activities. The question of doing case study, because so many of the people, both sufferers as well as those involved in social solidarity, were very much in touch with me. But for me, it was ethical dilemma. Like when I was a full-timer of Women's Center while providing support to a survivor of violence, I have never written about them. It's an ethical dilemma, because when you are the supporter, how can you write about them personally? That's why I have written more in terms of a generalized thing. I have not used anybody's testimony except for Anil Hebbar, who was himself in a major relief operation, and his quotation I have taken. That too, after a lot of thinking, I did that. So that is one. But I think all the suggestions are extremely important, and I think Dr. Vina Vaswani is highlighting COVID widows, plight of COVID widows and COVID orphans. Then this Dr. Swati Rane, that more special attention to be paid to be given to healthcare workers, who constitute 70% of the total healthcare force, and the work which happened, like Anganwadi workers, Asha workers, they got mobilized, and they also articulated this thing. WHO gave them award, but still the state doesn't treat them as worker. I fully accept. The question of Dr. Sanghmitra, he also talked about transgender persons, major special attention, about which I am myself getting acclimatized in terms of the theoretical formulation, reading more and articulating. For my 3 years in TIS gave me more understanding of the question, but I think it's extremely important to focus especially on that. The question with the issue which Dr. Ansari brought out about the sociability, why it is so important, and also bringing classroom into kitchen, I think it's a very important, and that needed to be more but new, but I think that needed special mention. The sex workers and HIVs, we have seen so much of stigma. We have personally experienced while negotiating for resources from various agencies, and I think that requires special attention. I fully accept. And suggestions which Dr. Manimeklai gave in terms of the processes of community intervention, I think that can be definitely captured. Because that when the chapters were written, it was just on demand by the newsletters of various NGOs and community-based organizations. So they were written in that language, that thing. But now I think one can make it more detailed and put it in the analytical framework. The best suggestions Dr. Manimeklai gave is about the best practices. I think it's very important, not only for us, but all those who were active during those 2 years. I think we need to document these best practices so that the mistakes which were made or whatever limitations we had faced, they can be corrected in future, because one who doesn't learn from the history always repeats the mistake of history. That we all accept. And the last one, this question of deglobalization, what one felt, because right from economists and social scientists and even the policymakers were talking, the way supply chains were disrupted, that now we need to think more in terms of decentralize this thing, and also the community-based approach in terms of production, distribution, circulation. So I think about that also, I accept that more needs to be worked. I think this whole session, as and not your inputs from all 7 of you, have served as a tonic for me. It has really provided me moral boost to work seriously on this issue. One gets caught up in the day-to-day activism of the local organizations, but I think one has to give a special time to articulate and reach out to larger people, because otherwise most 5 publishing houses which are controlling all the best all the best researches, I think I don't want that. I congratulate IMPRI for demystifying knowledge and taking it out to the community at a very affordable cost. And most of the knowledge resources created by IMPRI are in public domain, freely downloadable. So I think that is really important.
Yes.
But currently, otherwise, my own articles, when I try to download, that publishing house is asking for $120 and 80 euros. So I think that from that perspective, this kind of a lot has been written about pandemic, but it is accessible only to extremely rich universities, mostly the private universities can afford those rates. Even my own book, I'm ashamed to tell, it costs 11,000 rupees. No, and even the digital copy, it cost 8,000 rupees. So that is the way, and that's why this kind of platform which are provided to us become very important. And I'm thankful to IMPRI for that. I fully accept all your suggestions.
Okay, so I would like to deliver my vote of thanks. So as we come to end of today's discussion, I, Shweta Shankar, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks. On behalf of #IMPRI, Gender Impact Studies Center, GISC, I would like to thank all of you for attending today's deliberation. A book discussion on an intersectional gender discourse on empowerment during pre- and post-COVID-19 pandemic, authored by Professor Vibhuti Patel and published by IMPRI Books. Congratulations, ma'am. We are grateful to our chair for the session, Professor Sanghmitra Sheel Acharya ji, our esteemed panelists, Professor Vina Vaswani ji, Dr. Swati Savantrani ji, Professor Arvinder A. Ansari ji, Professor N. Manimekalai ji, and Dr. Sanghmitra Barua ji for taking part in the discussion and enlightening us. Lastly, we would like to thank and congratulate Professor Vibhuti Patel ji for her book and leading today's discussion. We thank all of our participants for actively participating in today's deliberation. We are grateful if you're watching us later on YouTube channel or listening to us on our various podcasts or reading our publications. You may also find more book discussions and thematic events under IMPRI #WebPolicyTalk series. We hope you continue to join in future to our IMPRI Web Policy Talks and Web Policy Learning. Wishing you a good evening.